Good day everyone, we are from Block NF, RLE Group 2, and we will be presenting our concept map about Duchenne's muscular dystrophy. By definition, Duchenne's muscular dystrophy is a hereditary illness characterized by gradual muscle degeneration and weakness caused by changes in a protein called dystrophin, which aids in the maintenance of muscle cells. Signs and symptoms may vary according to the type of muscular dystrophy the patient has and the age he or she has been diagnosed. But common signs and symptoms include muscle weakness, difficulty walking, frequent falling, contracture or limited movements at certain joints, heart problems, problems with breathing and swallowing, and lastly, muscle pain or stiffness.
Predisposing factors are the following. First is gender. Most forms of muscular dystrophy have an equal prevalence among men and women. DMD, the most common form of muscular dystrophy, affects male almost exclusively. Second is genetics. Muscular dystrophy is almost always passed through inheritance. The different types of muscular dystrophy vary between autosomal recessive, DMD, most forms of CMD, and autosomal dominant, FSHD, and DM. And lastly, age. Age varies greatly between muscular dystrophy disorders type. DMD onset is between 3 to 5 years of age. DM onset between 10 to 30 years of age. FASHD in young adults, CMD at birth or early infancy, and LGMD in either child or adulthood, depending on the type of LGMD. Rarely is muscular dystrophy found to have been developed spontaneously, since it is primarily a genetic disease. But lifestyle factors that may have a hand in disease development are: first is low body mass index, or BMI. A lower BMI or an underweight patient may affect the body's ability to gather a sufficient amount of nutrients to aid in muscle repair and recovery during muscular dystrophy. Second is sedentary lifestyle. A sedentary lifestyle and a lack of regular physical activity can disuse of muscles, leading to muscle wasting and weakness and exacerbation of onset muscle dystrophy.
The following are the diagnoses for the disease. First, we have the impaired physical mobility, which may be related to musculoskeletal impairment or weakness, possibly evidenced by decreased muscle strength, control, and mass. Second, we have the risk for delayed development, possibly evidenced by risk factors of genetic disorder or chronic illness, learning disability. Risk for overweight or obesity, possibly evidenced by risk factors of sedentary lifestyle and dysfunctional eating patterns. Compromised family coping may be related to situational crisis and emotional conflicts around issues about the hereditary nature of the condition. For the healthcare management, we have the medical therapy. First one, we have the corticosteroids, which helps the muscle to strengthen and delay the progression of certain types of muscular dystrophy. Second one, we have the heart medications. Angiotensin converting enzyme or ACE inhibitors or beta blockers are usually prescribed if muscular dystrophy damages the heart. Eteplirsen, Exondys 51, the first medication to be approved by the Food and Drug Administration or FDA, specifically to treat some people with Duchenne muscular dystrophy. And the last one is Golodirsen, Vyondys 53, for treatment of some people with Duchenne dystrophy who have a certain genetic mutation.
Physical therapy. Range of motion and stretching exercises. Muscular dystrophy can restrict the flexibility and mobility of joints. Limbs often draw inward and become fixed in that position. Range of motion exercises can help to keep joints as flexible as possible. Exercise. Low-impact aerobic exercise, such as walking and swimming, can help maintain strength, mobility, and general health. Some types of strengthening exercises also might be helpful, but it's important to talk to your doctor first because some types of exercises might be harmful. Braces. Helps keep muscles and tendons stretched and flexible, slowing the progression of contractures. Braces can also aid mobility and function by providing support for weakened muscles. Mobility aids. Canes, walkers, and wheelchairs can help maintain mobility and independence. Diagnostic tests and exams. Enzyme tests. Damaged muscles release cis enzymes such as creatine kinase or CK into your blood. In a person who hasn't had a traumatic injury, high blood levels of CK suggest a muscle disease. Genetic testing. Blood samples can be examined for mutations in some of the genes that causes types of muscular dystrophy. Muscle biopsy. A small piece of muscle can be removed through an incision or with a hollow needle. Analysis of the tissue sample can distinguish muscular dystrophies from other muscle diseases. Heart monitoring tests. Tests like electrocardiography and echocardiogram are used to check heart function, especially in people diagnosed with myotonic muscular dystrophy. Electromyography. An electrode needle is inserted into the muscle to be tested. Electrical activity is measured as you relax and as you gently tighten the muscle. Changes in the pattern of electrical activity can confirm a muscle disease. Disease process. The disease begins when there are mutations in the encoding dystrophin that then abolish the production of dystrophin in muscles. Without dystrophin, these muscles are more sensitive to damage. This results in progressive loss of muscle tissue and function, in addition to cardiomyopathy.